So let's start by answering the first part of this question. How is HIT used in the diagnosis of patients? Before we dive into how we use HIT for diagnosis, let's first start with a definition so we're all on the same page about what diagnosis means. According to the American Medical Informatics Association, or AMIA, diagnosis is the process of collecting data about a patient in order to determine which disease or condition best explains the patient's symptoms. It's important to remember that we refer to the medical field as the practice of medicine and not the absolute facts of medicine. This is a comment that was once said to me by a hospital physician who was explaining to me how medical diagnoses always include some guesswork, since clinicians only have so much information to go on when they're trying to understand the complexities of the human body. Clinicians make educated guesses based on their own experience and practice in order to determine what is wrong with a patient. Now, this diagnosis process relies on accurate data, which is traditionally collected during what we call the history and physical, or H&P, part of a patient's visit. The H&P is when a doctor or nurse talks with the patients about their medical history, previous medications, allergies, etc., and then performs a physical and visual assessment of the patient to best understand his or her physical condition. However, as stated in this definition, diagnosis data is starting to include the integration of other data sources, aside from just H&P data, in order to help clinicians accurately diagnose patients. So what does this diagnosis process look like? Well, there are three common methods of diagnosis. The first is based on simple pattern recognition. This is where physicians will gather data about a patient's signs and symptoms and start to notice a pattern that's related to a specific disease or condition. However, this simple method of connecting the dots usually only works where there is a disease or condition that has more obvious characteristics. For instance, if a patient presents with a runny nose, itchy eyes, a bit of a stuffy nose, maybe she has some sneezing and scratchiness in the throat. Oh, and by the way, it's also the month of May, when the weather has just started getting warmer. The doctor can look at the pattern of symptoms and start to connect the dots to see that the patient probably has seasonal allergies, or at least some sort of mild allergic reaction to her environment. Now, in other scenarios where the pattern is not so obvious, the physician will perform what is called differential diagnosis. This starts the same way, with the physician gathering as much data as possible about the patient's signs or symptoms, and then identifies or brainstorms any possible disease or condition that could be related to what she is seeing. Then, through the process of elimination, the physician identifies the most likely options in order to pick a test or other evaluation that can help to narrow down the possibilities. Throughout this process, wouldn't it be great if we had help trying to identify these patterns, or to help us determine which condition is most likely related to the patient's symptoms? Well, that is where clinical decision support, or CDS systems, come into play. On the previous definition slide, it mentioned that there is an increase in the use of data integration in order to help doctors more accurately diagnose their patients. Well, this data integration can happen in clinical decision support systems. CDS systems are a type of smart software that provides guidance and suggestions to the physician as she performs differential diagnosis. Imagine that you're a doctor, and as you perform the history and physical of your new patient, you can just check off symptoms and characteristics in a checklist. The smart checklist then answers by providing suggestions for what tests to run or what scans to order. As more data is collected about the patient, the more narrow the search becomes for the correct diagnosis. This is all facilitated with the help of Health IT. There are many technologies that are advancing how clinicians can better diagnose their patients. For this lesson, we'll focus on two of those areas. The first was just mentioned as a common way in which physicians currently diagnose patients, and that is using clinical decision support systems. The second area is about advancements in early detection. This includes making the patient a more active member in the diagnosis process through advancements in use of mobile health technologies and even social media. Let's start with clinical decision support. CDS systems are a type of health IT that allow clinicians the ability to intelligently filter and view patient data in order to help them ask the right questions so that they can accurately diagnose their patients. There are four primary goals of CDS systems. These goals include providing patient data that is accurate, complete, and appropriate, and that is visualized in a way that makes it easy to understand. Doctors, nurses, and other clinicians have a constant flow of information that they must take in all around them throughout their daily work practices. So, helping clinicians visualize that data in a way that improves comprehension and that pattern recognition is key. Additionally, CDS systems also help present patient data at the right time in the diagnosis process and present it to the right person on the patient care team. For instance, a CDS system that alerts a nurse that a patient is allergic to a medication that she just administered 2 minutes ago is really not helpful. But if the system could know when to present that alert, let's say when the doctor first orders that medication, then it can reduce medical errors, money, and time. Let's take a look at another example of how CDS systems help create a better healthcare system. I'd like you to meet John. John is an elderly asthma patient who suddenly develops severe knee pain while getting up at home. However, his normal doctor is out of the office for the day, so he schedules time with another physician in his doctor's office, Dr. Sullivan. When John arrives at the office, the EHR system provides Dr. Sullivan with documentation of John's last visit. This includes his recent lab results and a list of his medications. Due to the severe pain that John is in, Dr. Sullivan prescribes a common pain medication to help ease his pain. The doctor provides John with a prescription for the pain meds and sends him on his way. However, within 2 months, John has a painful ache in his stomach that sends him to the emergency room. It turns out he has a bleeding ulcer that, after some diagnosis, was found to be caused by an adverse drug interaction between the pain meds and the patient's normal asthma medication. Now, most doctors don't know every negative drug interaction that exists between medications. There's just too many of them, especially between medications that are prescribed for different types of conditions, like asthma and pain management. However, if Dr. Sullivan used a clinical decision support system, it might have prevented John's ulcer. A CDS system would have alerted Dr. Sullivan about the adverse drug event right at the point of care. And as a result, John wouldn't have been prescribed the meds and then developed the ulcer caused by that drug interaction. Recent studies even show that CDS systems reduce the rate of rehospitalization in patients over the age of 50. This 50-plus patient demographic is actually found to be on the most amount of medications, which makes them most prone to having these types of adverse drug events. A well-designed CDS system can greatly help in this scenario. Now, let's take a look at what type of data is typically found in a clinical decision support system. When it comes to preventative care, CDS systems can help clinicians see previous immunizations, as well as the need for any new ones. It can also help alert clinicians to previous screenings, or alert them about recommended screenings based on other factors. For instance, research suggests that women start getting screened for breast cancer at the age of 40. So a CDS system could create an automated reminder for the doctor to recommend this when the patient turns 40. The CDS system can also help with disease management guidelines. As we previously discussed, CDS systems are very helpful with diagnosis, especially providing suggestions to help a clinician narrow down the possible diagnoses based on various signs and symptoms that the patient exhibits. Third, once a diagnosis is determined, clinical decision support can also help with planning or implementing treatment for the patient. This can include providing data around treatment guidelines for specific diagnoses, drug dosage recommendations, and alerts for any drug-to-drug interactions. This was illustrated in our previous example of John and Dr. Sullivan. Another important part of patient care is the follow-up to ensure that patients are continuing to do well by being compliant with their treatment plan. This is where CDS can help with follow-up management by including reminders for continuing a specific treatment order or script, or providing alerts for any drug adverse event monitoring. CDS systems can also help with hospital or provider efficiency. This means that the CDS system can help shorten the patient care process by making certain tasks faster and easier for the clinician and the patient. For instance, CDS systems can provide standard care plans that aim to minimize the length of stay for the patient. This lowers the costs and the use of resources for both the hospital and the patient. Additionally, CDS systems can also provide what are called order sets, or a combination of specific diagnosis tests, or treatment plans or medication scripts that are tailored to specific diagnoses. So if a patient is identified as having shingles, then the clinician can select an order set, which provides the standard diagnosis and treatment plan. This cuts down on the time it would take for the clinician to manually add each individual order into the system. The clinician can then customize the order set to fit the patient's specific needs. Lastly, CDS systems can include data that aims to reduce costs and improve patient convenience. Two ways that the system can do this include alerting doctors about any duplications in testing. Many times clinicians may order the same test twice, especially if there's a change in shift or multiple people taking care of the patient, which is very common in hospitals. This alert helps reduce the cost and inconvenience that the patient incurs when duplicate tests are performed. Second, the CDS can also provide a drug formulary guideline or a medication list. This list is essential for clinicians to understand the history and current state of the patient's medication intake, but this list of medications can be quite tedious for patients to constantly repeat and keep up to date every time they go to the doctor, especially for older patients who are sometimes on 15 to 20 different medications. So this medication list offers convenience by keeping an accurate record of the patient's previous and active medications. Now, the key to this, of course, is always ensuring that that list is in fact accurate and up to date. Let's shift our discussion from CDS systems to how HIT can be used to help with early diagnosis. As we talked about in Module 1, PHRs and mHealth technologies are getting patients more engaged and feeling more empowered in the management of their own health and in the health of their loved ones. This includes making them an active member in the diagnosis and treatment processes as well. There are many mHealth apps that we've already discussed that can allow users to track their data, look for patterns or trends, suggest issues, and provide recommendations for treatments or behavioral changes to improve the issue. But in this lesson, we'll talk about some newer advancements in mHealth and HIT that researchers are exploring to help patients and clinicians better diagnose issues. Although there are many interesting initiatives in HIT diagnosis, we will focus on 3 areas that directly involve the patient: the use of mHealth for detection of skin or eye issues, mental health concerns, and even cancer. Many mobile phone users get excited when new versions of phones are released due to the improved functionality and features that become available. Consumer research actually shows that the one feature that most users look for in new smartphones is advancements in the camera capabilities. Being a photographer myself, I always get excited to hear about this. I remember when the iPhone announced the new portrait mode that allowed for a simulated depth of field in photographs, meaning that the main subject was in focus and the background was blurred. This technique was never possible before with the phone camera. You could only really obtain this visual effect with a bigger digital SLR camera that allowed for adjustments to the f-stop aperture setting. So these camera advancements in mobile phones are really helpful to everyday consumers so that we can all take better photos and videos on our travels and throughout our daily lives. We can then easily post them to our favorite social media site or send them to friends in a group chat. But the advancements in mobile cameras are also being used to do some pretty extraordinary things for health monitoring and detection as well. One of the most discussed areas is about how smartphone cameras can help detect skin cancer. We talked about the app FirstDerm in our mHealth lecture, and this app primarily uses the camera to identify problem areas that are possible. But the diagnosis part is typically done by a human dermatologist who looks at the photos on the other end of the app and then provides recommendations to the user as to whether they should go see a doctor or not. But advancements in the cameras and in artificial intelligence algorithms are making it easier for our phones and apps to do the actual diagnosis as well. For instance, researchers at the University of Texas Health Science Center at Houston reported using what were called smartphone microscopes to diagnose skin cancer. These microscopes are available for consumer purchase and simply attach over the top of existing smartphone cameras. The U of T researchers stated that they were able to use the smartphone microscope technique to diagnose non-melanoma skin cancers with about 90% accuracy, and then cancerous melanomas with about 60% accuracy. Another use of smartphone cameras is for the diagnosis of eye issues. One person who was inspired by this idea is Brian Shaw, a chemist at Baylor University. His son was born with a rare form of eye cancer called retinoblastoma. Doctors later pointed out that individuals with these eye tumors may have a white reflection that is visible in photos when a flash is used. As you know, some people have a standard red eye when a camera flash goes off, but others may have this white eye. This comment made Shaw realize that other parents might be able to catch their child's eye issues sooner if they knew about this. So, he worked with the computer science researchers at Baylor University to develop an app that helps to detect this white eye and alerts parents of possible issues so that they can go see a doctor to learn more. Now, as with any new technology like this, it's always important to remember that these are simply tools used in the detection process, and users should always refer to an experienced and trained professional before diagnosing themselves. However, with advancements in machine learning, where computer programs take in new data to teach themselves how to better perform tasks, we will most likely see a day where consumers are better at accurately diagnosing these types of issues than a trained professional. But until that time, it's important for all of us to remember that we should be checking with a professional first. Another important point to make here is that this type of smartphone technology is wonderful for improving healthcare in developing countries. When you think about rural areas in third world countries, there are limited tools and trained experts available to help provide accurate diagnosis and treatment. However, because many of these small villages do have smartphones, since the smartphones provide so many capabilities in one small device, we can think about how this type of smartphone diagnostic technology could help proactively identify health issues in these small remote areas so that proper resources could be sent to help with their issues. Additionally, advancements in machine learning algorithms and the use of social media data can also help detect various types of mental health issues. Social media is defined as online platforms that provide individuals with the ability to post and consume user-generated content to a specific community of users. This content can include text, photos, videos, and even audio files. I'm sure that all of you participate in social media in some way or are at least familiar with the popular platforms like Facebook, Twitter, Instagram, or Snapchat. Social media also includes the use of sites like Amazon, iTunes App Store, Yelp, and so on. Most informed users know that social media sites have access to our data, and they share that data in an anonymized way with other third-party providers, like advertising agencies. As seen in the news, the sharing of users' social media data has recently become a privacy concern with sites like Facebook. Although there are many valid concerns about sharing social media data, access to this data is also very exciting to social science researchers, as it offers an opportunity to look for trends and patterns in user-generated content in order to provide insight into online behaviors. More recently, health researchers have also been seeing the benefits of using social media data to detect or even predict various types of mental health issues. 2 recent health IT studies describe how social media data can detect individuals who have bipolar disorder and can also predict women who will experience postpartum depression. At a university in Taiwan, researchers describe how the signs of someone with bipolar disorder include over-talking, disturbed sleep, and rapid mood changes. So these researchers created algorithms to characterize Twitter posts based on the amount of details in a post and the amount of rapid posting, the time of the postings, and the emotion being expressed in the post so that they could monitor mood changes. They then created a machine learning predictive model to see if their algorithms could detect users who were known to have bipolar disorder just by their Twitter content, to see the success rate of their predictive model. They found it to be successful, so they're now using the tool to proactively identify individuals who exhibit the same signs, in hope of providing those individuals with early interventions or resources to help them seek out guidance and help from healthcare professionals. Additionally, researchers at Microsoft are also using social media data to help identify postpartum depression in mothers. As you may know, postpartum depression is an understudied and under-discussed health disorder that affects new mothers and can result in serious health issues for both the mother and the baby if it goes untreated. The researchers evaluated the user's social media factors, including things like social engagement patterns, emotions expressed, interaction with those in their social network, and linguistic style. After creating their predictive model, they were able to predict mothers whose emotions were going to significantly change following childbirth with an accuracy of 71% using only prenatal data, or data collected before the birth. That accuracy then increased to 80 to 83% when the researchers added in 2 to 3 weeks of postnatal data as well. Mental health is a difficult topic to discuss, and many individuals who suffer from various forms of mental health issues never seek treatment due to either denial or fear of the social stigma that goes along with the diagnosis. This is such a critical problem that needs to be addressed to ensure that individuals are living healthy and happy lives. With advancements in the use of social media data and mHealth technologies, we may be able to help offer interventions to those affected much earlier in the diagnosis timeline, which is a wonderful discovery. The final newly emerging area of mHealth diagnosis involves how smartphones could be used in helping to diagnose cancer. Many types of cancer are difficult to diagnose without advanced diagnostic equipment. However, a large portion of the global population do not have the money or physical access to this advanced equipment, which creates a huge barrier to encouraging proactive detection and diagnosis for global health. But this is starting to change with advancements in mHealth technology. I'd like you to watch this inspiring TED Talk by Jorge Soto. Soto is a self-described cancer technologist and the CEO of the startup company Microculus. He is passionate about providing a low-cost, easily accessible solution, regardless of location or economic status, by bringing cancer detection to anyone with access to a smartphone. Watch this talk to learn more about this innovative and inspiring mHealth diagnostic idea.